motoni kavu ololo takataka imetapaka tulinde mazingira jamani twahitaji hewa takataka imetapaka tulinde mazingira jamani twahitaji hewa safi.
Good afternoon. Good afternoon, Pradeep. Nice to see you. We had yesterday a very interesting sessions on engagement of the private sector, relationship between the private sector and faith communities, and we spoke a lot about innovation. And really today, it's very important for me that to have this session specifically on innovation. We are going to speak with you now on leveraging innovation to build resilient system for health. And later in the afternoon at 5 p.m. CET, we are going to speak on another topic, how can we make that innovation accessible for the most vulnerable. Then it's really my pleasure, dear Pradeep, to have you with us and to have you chairing that session. You are the Director, Program Partnership and Fundraising at UNAIDS. You are one of the co-founder of the Health Innovation Exchange Initiative, and even more, you are a very good friend of Ahimsa now for many years. Then I will let you lead that session, and but I want really to thank you very much the speakers that you are going to, and you have invited to your session, that I want to mention Shiv Kumar, Sarida Khalid Eriksen, Mark Bonneville, James Baer, and Joe Tucker. Then Pradeep, thanks again, once again, and don't hesitate during the session to ask your questions on the platform. We are going to keep 20 minutes at the end of the session to ask the question and to launch the dialogue, but I let you lead now, Pradeep, and thanks again for your contribution. Over.
Jean-Francois, thank you so very much. It's a real honor and a privilege to be here with you and to be part of this forum. Usually, I've been to the Ahimsa forums, and as I've said in the past, it's a fantastic location. I miss being next to the Annecy Lake, but also more importantly, the face-to-face connection that is so important for us when we are meeting. So it's a pleasure to be here virtually, and we all know why that is. We have a huge challenge with the pandemic that we are all facing. We're all living in very interesting times. And as Charles Dickens said, we live in, the best of times and the worst of times. I think the worst of times because we are facing one of the largest and probably one of the most dangerous challenges that's been posed by the coronavirus today. Over the last 18 months or so, we have about 180 million people who have been infected, and we have lost nearly 3 million people to complications related to COVID. And what is really a struggle is that we still do not see the end in sight. We do not know where we are in that tunnel because we do not know what the eventual social, economic, and the broader health impact on so many things beyond that, including education, what it is going to be. I think from mental health to the impact on health systems, I think the system that was already overburdened before COVID has we have reached that kind of breaking point. And already, I know some of you, when we had discussions, you already said that we are working with an antiquated health system, which is underfunded and already overstretched. So that is if I can say, that is the worst of times. But also, what is fascinating about the last few months is the human ingenuity. We have seen innovations emerge from all over the place at all levels. We have seen new ideas, whether it is new ways of testing, it is about new vaccines, it's about delivering healthcare in different ways, which we would have never thought possible, even just 12 months ago. And we are seeing countries embrace innovations and providing an opportunity for us to do things. And much more also importantly, the selfless spirit of the um, frontline workers. So there's so much that we can celebrate, but there's also so much that we are losing. So what I really want to do is to use the next a little bit less than 90 minutes that we have to bring together this panel, which is absolutely, again, it's an honor and a privilege to have such a panel. Somebody called it the VIPs. Certainly, each one is a VIP from a health development, innovation, financing perspective, but also they are virtual interactive panelists. So that's what the VIP stands for. So I'm going to make sure that this session is interactive. We want to draw on people's uh, I know that there are several questions out there. So if you're listening in, what I would like you to do is to use the chat function to send in your questions, and then we would like to call you in to present your questions. I think what I would like to really focus on today is how can we find solutions to build resilient health systems? Again, I don't want to use the word post pandemic because we do not know what that is and when that is and what that will look like. But certainly, how can we fundamentally even before the pandemic, 1 in 2 people did not have access to basic healthcare. Yeah. So now we are in a situation where that is going to be further exacerbated by COVID. If we, well, the other, for those of us who are working in this sector, we also are fairly certain that this is not going to be the last of the pandemics. We have had 4 influenza pandemics over the last 100 years, and they're coming in much more closer frequency than before. So this is not going to be the last of the pandemics. We need to prepare ourselves for the future. What will it take to build resilient systems that leverages all the developments that we have seen over the last at least 20, if not 30 years? So, having said that, I'm really, really privileged to have this panel. I want to start with Shiv Kumar. Shiv, you call yourself a mentor, and I've known you for several years, and I've seen you as a thought leader. You're head and shoulders above so many people when it comes to thinking and looking forward on what is happening with health, what does it take to deliver healthcare to the most vulnerable. But also, what's been amazing about you is that you're not just that giant with the head over the clouds, but you also have feet on the ground. You have systems on the ground. You work, get your hands and feet dirty. So it's a real pleasure because you look at practical intricacies and work with communities on delivering healthcare. Were we not prepared for COVID? What is working? What do we need to look for into the future? Um, Shiv, you're calling in from Bangalore. I would also like you to speak about what's happening in India, and both from the uh, significant progress that's been made, but also the challenges. Thank you, Shiv.
Pradeep, and thank you for this opportunity, Ahimsa. I think a real honor to be here with all the panelists. Pradeep, there's a new term which is describing India, and it's really a subcontinent which really difficult to describe, but called the flailing state. Not failing, but flailing. That's probably a very good description of where we are in India with a huge amount of challenges, and many of which you have spoken about just now in terms of the health system not being ready. But I think what was extraordinary is how a health emergency very, very quickly became a humanitarian emergency. And how the lockdowns, which were very, very quick, uh, not in terms of sequence. Actually, we should have shut down international travel, which we didn't, but we shut down migrants traveling home, which is like 300 million people, poor people who live in cities and work. And for them to go back, but be stuck in the middle was an extraordinary, humanitarian emergency. We have not seen anything like this. I mean, I have been in the forefront of some of the earthquakes, tsunami response, but what we saw in India was really, really heartrending, and continues to be. It's not yet over, as you rightly pointed out. And that's where we set up this collaborative, which was almost a desperate call, saying that we can't do things alone. And currently, we are around 326 organizations, which spans civil society, private sector, as well as the government, who's also part of the collaborative now, the local governments. And what we have been doing is three things. One is delivering relief, and by relief, we always thought food and medicines. I think today delivering hearing aid batteries is also relief because the elderly are not able to move around, right? So relief of all kinds, and now we are gearing ourselves up for a massive vaccination drive. And also primary healthcare has pretty much collapsed. So telecare is another area which has taken a big push. And telecare, not the usual, let me pick up the phone or a WhatsApp call and call somebody. It's much more sophisticated than that, which has got multiple layers. All of this we are doing, but just not enough. I think what government is doing is not enough, and what all of us are doing is simply not enough. But given what our subject is today, Pradeep, I just wanted to talk about three types of innovations, which the COVID Action Collaborative and in India, which we're seeing, which usually is bustling with innovations. One is, I think, there is always a over focus on products, finance, and technology innovations. I think the people and system innovations is something we are seeing during the COVID times, which is really phenomenal. For example, one of our partners put together this concept of sanitation health entrepreneurs, which is essentially about cleaning public places, uh, so that it's free of COVID. At the same time, generating jobs. Jobs are in short supply, right? So putting these two things together is a good system innovation that we have seen. And also, the labor market has pretty much collapsed, which was anyway informal. And a bunch of us have come together with some of the top brands in the world to see, is this a good reset button to really change the way the labor market works? And it doesn't work for the poor, but can we use this opportunity to really change the way the labor market operates in India, at least in pockets? Can we begin? So there are some really interesting innovations going on there. And if I could stop here and then probably come in later, Pradeep.
Thank you very much, Shiv. That's really fascinating stuff, and I'm going to pick up on that when we come back to you. And one thing which we often hear is that the world is not going to be the same whenever we get out of COVID. And I always say, yes, we have two different paths. One is that we can get back to the past and go back, or we can actually do something. We can create a new world that responds to all the issues that you're citing, from resetting the labor market to access to jobs and using health as a vehicle for economic opportunities. But that's also a very interesting place to connect with Shariha. Shariha, really pleasure to have you on this call. Shariha is the managing partner for Mission and Co. based out of Malaysia. Shariha, you have been an advocate for the last mile healthcare delivery, and you have really focused on bringing together 100 innovations that can really make a difference in that last mile healthcare using innovations. Um, it'll be really fascinating to hear from you. Do you see a picture of hope? Do you see ideas emerging from there, which gives you a sense of optimism for the future, or do you see it as a challenge still?
Well, thank you very much, Pradeep, and thank you to the organizers for inviting me to be part of this.
You'll need to be
One,
closer to the mic, Shariha, because your audio is a bit too low.
okay, I'm not sure why it's at full at the moment. Maybe I'll try and speak a bit louder. Thank you. I was just saying, and I hope that the organizers could help queue up my slide presentation, please, whilst I address Pradeep's questions. Thank you to Shiv for starting us off. And in fact, I too have known Shiv for a good many years, starting off with our work with HIV/AIDS and drug addiction over 10 years ago, in fact. And very happy also to see Swasti and I for We, their new platform, that's connecting community health workers directly as one of the innovations on the Health in Your Hands platform. Next slide, please. So as you can see, Health in Your Hands really is about placing health into the hands of those at the front lines, and often those who are also left furthest behind. It was an initiative that was initiated by the UAE government in 2017 as one of their own leadership opportunities within the context of the SDGs. But it really evolved from, next please, what we saw to be a real need in the world of exactly what you mentioned, Pradeep, of that, 1 in 2 don't have access to basic health services, essential health services. And in fact, we have problems and challenges we're seeing on many levels, many of which have actually been further aggravated by the pandemic. For example, this was data from quite a few years back. We were 18 million short in terms of health care workers. We now have about 135 million in a recent study done by WHO, of which 45 million are not digitally connected. That in and of itself is already a challenge, right? Because they're serving at the front lines, but they're not able to access even the basic digital devices that can help them do their work effectively. And of course, mental health was already quite high. It was kind of underfunded generally in the global health space, and it has now become worse and been accelerated by the pandemic. So we're living in a world that has many challenges, and particularly those left furthest behind are the ones most affected. I just came off an event with, in fact, Joe Tucker, one of the panelists, looking at solutions from young people to imagine the world anew post-COVID. I know we don't know when that post-COVID phase will be, but certainly young people are one of those who have been most severely affected, not just from the direct effects of COVID, but also from the kind of economic instabilities that arose because of the pandemic and the prolonged lockdowns. Next slide, please. So for us, really, next please, when we came up with this concept of health in your hands, it was to try and change the narrative from the last mile being seen as that last mile to it being, the first priorities, really, and to really drive it through the individuals and organizations who know how to do this best. Hence, really what we're doing with aggregating this pool of 100 innovations. Right now, publicly, we've announced 50, but we do have a very exciting partnership in the works that will bring it to 100 and synergize our works in relation to this. Really, what we're trying to drive here, next please, is that those who are already doing this work, they know how to do it. They are reaching those segments. And how can we build ecosystems around them, strengthen ecosystems around them so that they are connected, they are financed, they are capacitated, right, to be able to do their work better. And when we came up with some of the criteria, we didn't want to focus only on direct health innovations, but we also wanted to look at the broad things that are challenges that you see in the context of health, but also in the context of delivery of health services. So even basic things like access to water, sanitation, hygiene, access to energy, these can really disrupt how health services are delivered. Or even health diseases, even diseases can be prevented, right? Next, please. And we've also seen how, the pandemic showed the interconnectedness of the SDGs, that, when we're talking about health in the context of the last mile, you cannot just look at health on its own. You've got to look at other factors too. Next, please. And next. So essentially, with these 100, next, please. Yeah, just going to skip through. Next slide, please. And the next one, thank you. So really, I just wanted to show this slide. So you can see from these are the 50 that we've published now. And, you know, you have organizations that are NGOs, you have multilateral agencies, you have multi-billion-dollar companies, but you also have the startups who are doing amazing things, right? And really what we're trying to do is recognize that there are many ways that you can reach that last mile and many sort of instruments that you could mobilize to finance the scale up. You don't necessarily need to bring in investors. You could also bring in grant money, you know, implemented in a hybrid model. You could work with public financing. And what we're trying to do is to basically say that, you know, let's work with those who are already doing great work and help make the connections that can help them to scale. Next, please. So, for example, if we looked at thematic areas of focus, some of the innovations cover things like livelihoods, you know, and economic opportunities for women. Others cover the health equity and access. Next, please. And some others on mental health and workforce well-being, and what I mentioned earlier, access to technology and innovative tools for the workforce. Next, please. And really, you know, like I said, you know, we are entrepreneurs ourselves. We know how hard it is to raise financing for doing early stage work or even scaling up existing work. And from the years of doing this, we have learned that there are 6 items that most organizations seek to scale their impact. And that is, of course, the typical money, mentors, and markets. But in addition to that is also the kind of management, the talent that's driving this, how they're communicating about their mission and measuring their impact, and then also the kind of media and visibility opportunities that can help them communicate about their work. I think that was the last slide. Thank you. Can we just see if there's anything else? Next, please. Yeah, I think it was a video that you know will be made available. Oh, maybe we're playing it.
Thanks. Maybe I'm going to stop you there because maybe we could switch the video back and we can provide a link to the video in the chat box if that's okay, Olivia. Thank you. Maybe we can go back to the panel if that's okay. I can see Jean-Francois, but I'm sure the panel is somewhere there, the virtual panel. I promised it to be interactive. So I'm going to, for those of you who are listening in, I'm going to give you a question. I told you it's not a free show. It's something where you have to do your homework. So I'm going to ask you in the chat box, if you could describe in one word. You have just one word. You can cheat a little bit with hyphenated words, but one word. When you think about post-COVID world, what you want to see in terms of your vision, describe it in one word and post it in the chat box. Would love to see that. We are receiving several questions. I'm going to hold on the question, but Tariha, I really like the way you spoke about the intersectionality of health, because it's not just about health as an outcome, but in order to get there, you need to speak from energy to education to the whole supply chain and logistics, so many different things. So I'm going to slightly change the kind of order of speakers. I really also felt that you raised an important point around the issue of financing. And I've been a huge critic of the way we finance health currently. A lot of it is certainly from the public sector, from domestic budgets. And then you have a lot of external ODA funding, which often tends to create a number of pilots, but nothing goes to scale. We really, if we want to get to a post-COVID resilient health system, we need to really rethink financing of healthcare, particularly in low and middle income countries. I'm going to turn to James. James, you are one of the pioneers when it comes to rethinking financing for health and really looking at building strong businesses which are sustainable but also have impact. Are we there? What are the challenges? Is the health innovation ecosystem sufficiently robust for someone who's looking for market returns to come and invest? Is there an opportunity, or is it still a challenge? Is that an important, at least from your perspective, is it important to bring private sector investments into building resilient health systems?
Thank you, Pradeep, and hello to fellow panelists. It's a pleasure and an honor to be here with you. I'm so engaged in these conversations. I find I could go off on a bunch of different tangents, but you've teed me up, Pradeep, and I appreciate that. With this group in particular, but I think with the audience at large, we don't need to define and redefine the problems. But there is a framing of the problem that we use at my company, Baraka Impact Finance, which is the size of the annual budget that's needed to meet SDG 3s by 2030 for the world's poorest countries. And according to Lancet, that's somewhere between $260 and $370 billion a year. We know ODA is plateaued, and the gap that's left is somewhere in the neighborhood of 200 billion. This is huge. And I completely agree with Sharita that there are multiple ways of coming at this financing challenge, and we should be always pushing at all of those avenues, including blended finance and increased public spending and philanthropic work. But there is a player that's not sufficiently at the table, and that is private capital writ large. And it's particularly a frustrating scenario to observe, because the opportunities that I believe are there from a solely commercial perspective are increasingly significant. And private capital, even if you just put on the narrow lens of financial return, ought to be more interested in these opportunities than they have traditionally been. So, our mission right now is to win minds and hearts, and I switch that English idiom around because, unfortunately, I believe the minds need to be convinced first. The hearts are there, and we can make a compelling story for why we as human beings should care about these innovations and should find ways to finance them. But unless we can convince the minds and the traditional mindsets associated with profit and return, or at least stability and capital preservation, as a bare bones minimum standard, we're not going to mobilize private capital. So then that is the challenge that's in front of all of us. How do we begin to get people to think differently about the opportunity and their ability to significantly impact human lives with well-directed investments? And again, back to the reason this problem is particularly frustrating at this juncture, the technology advances of the last 3 to 5 years, and we can talk about the technology advances of the last 3 decades, and that makes all of our heads spin. But the last 3 to 5 years in particular are enabling a kind of leapfrogging over calcified global health problems, including mobile access, remote diagnosis, data aggregation, AI-driven clinical decision support. These technologies are now right in front of us and palpable, and there are many entrepreneurs around the world that are leveraging those technologies to make real change. And also to scale their businesses. And so what we're seeing at Baraka was a brainchild of my co-founders, really. I don't want to take credit for this, who looked at the need for capital for entrepreneurs that have solutions for low and middle income countries. They started looking at this 5 years ago, and what they thought at the time was, we need to find more $100,000 grants. That's what we need. Today, we look at the pipeline of companies that we're representing, which is approximately 200, and we realize that capital need has gone up significantly. We're talking to companies who have been in the market for 2 to 5 years and now are looking for 1 to 5 million US in capital to make their Series A or their seed series, whatever you want to call it, doesn't really matter. But their ability to scale and their capital need have increased. All the more reason that we need to get global private capital to the table. So there's a large communications, public awareness raising, framing that everyone on this call and everyone listening today needs to join in on. But I do believe we have a better story to tell today than ever before. Our specific objective is to marry excellent investment opportunities with impact-proven, impact-driven solutions with investors that have the capital and are interested in the combination of social impact and financial return. What we know is things that Sharita already touched on, is that this is an ecosystem question. These are ecosystem issues. And so the way we are participating is to think about all stakeholders in that ecosystem that need to be mobilized, focused on this objective of private capital participation in the solutions. And I'm a glass half full kind of person. And I believe we're at a really important juncture where incredible things are possible. And COVID has fueled that possibility for change and for private capital mobilization. So I feel like I give a bunch of generalities. I'll leave it at that for a moment, but I'm happy to get more specific with questions and with panel interaction. Thank you, Pradeep. I think you're muted, Pradeep.
I think that's the most famous phrase throughout 2020 and 2021. You're muted, some by choice, others without. But I'm going to come back to you. You don't need to answer this now, but I'm going to come back to you on this question. Fundamentally, we do a lot of work in Africa. 1% of 1% of the total funds, the private capital that is raised for investment, goes to Africa. So the risk perception that exists, my question to you is going to be, is the risk perception about investing in Africa very overrated, which is probably why the capital is not going there? But I'll come back to you on that question now. But there are two critical pieces which are really essential if we want to build resilient health systems, resilient systems for innovation and leveraging innovation. One of that certainly is the ecosystem and the local enterprise, local investments, local solutions. But also there's a huge opportunity for us to bring a better collaboration between the global north and the global south. And Mark, you have been an advocate for building that kind of collaboration and finding new ways of building that collaboration. And as part of the Mario Foundation, you have really led that work. I would love to hear, what are you seeing in terms of that collaboration? Is that coming together better? Do you see health as an opportunity to further improve that kind of collaboration, whether it is between public or private sector, or private sector with innovators? And what do you see as challenges, and where do you see opportunities?
I think that when talking about networking, I think that we have to address this more globally. And in particular, I think that clearly, if you want to leverage innovation to build resilient health system in LMIC, you need actually to clearly understand not only what the expectations of national institution or major research innovation centers, for instance, locally, but also what are the needs and implementation constraints of innovative solutions within the most remote or vulnerable community. So clearly, networking is key to achieve these goals. And I will try to briefly illustrate this through some actions that are undertaken by the Fondation Mérieux. So clearly, the foundation aims at helping low-income countries to tackle major public health problems primarily linked to infectious disease by strengthening national diagnostic capacities and laboratory systems, by improving access to conventional or innovative diagnostic tools, but also by reinforcing diagnostic research and innovation capacities. And these field activities are undertaken in close collaboration with key local stakeholders, be it Ministry of Health, public health agencies, laboratory directorates, or research centers at the national and regional level in order to make them more sustainable. And we encompass here also the financial sustainability of the innovative solution proposed. Also, they involve both centralized entity like national reference laboratories, as well as peripheral laboratories working at the community level in order to enhance their direct beneficial impact on and uptake by the most vulnerable communities. So if you consider typically the implementation of a diagnostic solution, be it conventional or innovative, you have to consider beyond its cost at least three other major points. First, the implementation constraints, that is the level of expertise and infrastructure that are required to implement it, its technical performance, sensitivity, specificity, positive or negative predictive value, for instance, and its added value, public or individual, for the targeted indication of population. When addressing each of these points, networking is key. For instance, if your diagnostic approach can only be implemented in a centralized structure with a rather high level of expertise, typically a national reference lab, you will have to consider how this centralized entity is connected with peripheral or community laboratories, how sample logistics is handled, and so on. If it is less demanding and can be decentralized, its implementation within a network of laboratory allows you to better assess its robustness and its added value to address epidemiological or public health issues, provided that the proper data processing and data exchange system between laboratories is put in place. Assessing the value of this tool either as a triage or diagnostic test at the global or community level will require a large array of technical, clinical, and research expertise to design and implement an ad hoc field evaluation, as well as social science experts to address uptake issues, as well as the cost-benefit ratio for a given community or a given country. And here again, tight networking between clinical research centers that gather all these diverse expertises and the communities is to generate meaningful results and propose solutions that will have a concrete beneficial impact for remote communities. And such a networking between central and peripheral laboratories or between research centers and community is typically what the Fondation Mérieux is fostering in each country where it operates. If we consider the situation of COVID-19, I should mention that what the Fondation has done before the sanitary crisis within its regional lab networks, and in particular by providing training of basic molecular techniques, quality management, data sharing, sample processing, and by strengthening lab system, all these have been key to quickly implement COVID-19 molecular diagnostic solutions, in particular innovative ones, even though such a training had to be done remotely due to the sanitary crisis. And I think that this has represented a great opportunity to demonstrate the importance of this long-term capacity building activity. On top of this, the Fondation has established regional or international network of diagnostics and or research centers in order to foster South-South research and training collaboration on shared diagnostic needs or on shared public health issues, including COVID. And the other objective of this network is not only to get additional funding from major public or private entities, but also to coordinate these actions within programs led by major international organizations. For instance, if you consider clearly, for instance, the detection of COVID-19 variants, I think that there have been a clear request from many developing countries for detection of COVID variants. And you have a number of innovative solutions that are more or less demanding. And basically, the first reaction is possibly to propose actually typically implementation of NGS approach and quite sophisticated strategy. But when thinking it over and considering the number of initiatives that are undertaken by international government or major NGOs, then perhaps the most logical approach is to think about more straightforward and quite simple solution that can feed this global initiative, and by taking advantage, by leveraging actually the network that has been established in close connection to the remote communities. And I think that the way we can improve access to innovation is not necessarily to provide innovation to the remote communities, but to make them connected to major networks where this innovation can be implemented. And I think that this is an important selection, an important lessons that can be learned from the COVID-19 crisis.
Mike, that's really, really interesting, especially what you're already doing in terms of linking with so many different ecosystems, but also what we have seen is that when you bring those different pieces together, what you get in return is not just the additionality, but it's a kind of a geometric progression that happens. So it's fascinating. I'm going to come back to you with some specific questions on if there are specific partnerships that can be established. Let me pass it back to the audience. If you're an innovator, give us a thumbs up, but also here's your pitching opportunity. Perfect it now. We need one sentence. If you're an innovator, you're looking for selling your innovation, as in you want to raise either resources, you want partnership, write it in one sentence in the chat box and send it. We will certainly pick it up. I know Joe is going to evaluate all this, so I'm always worried when we have Joe in the room because he's a master evaluator. He's somebody who is a design thinker. He's a social innovator. I'm going to come to you, Joe, but I just want to take a quick there are a couple of questions which are coming from the audience, which is fascinating. And I'm going to pass it to the panelists and then come back to your presentation, Joe, because I want you to also address some of these issues. Sure, I'm going to ask you this. What are the innovations that have worked when it comes to vulnerable populations? I would love to hear a little bit about the work that you're doing with sex workers and the marginalized groups. How do you, because the question here is what innovations are most appropriate for the most vulnerable groups? So I just want to pick that up and I want to relate it to what Joe is going to say.
To innovate every time. And in our experience, we feel application of innovations is underrated. And there is a certain sexiness to new innovations, right? And many times, it's existing innovations. If you're bringing to some of the problem areas, you can really do magic with. And I just wanted to give you two quick examples. The early warning system, which Netherlands had pioneered using sewage water testing, is something we brought to India. And during COVID time, it's really helping us help the government to think at least 15 to 30 days ahead in terms of where are the outbreaks and what can be done. And just to layer to your point, Pradeep, on vulnerable people, one of our work with Marks and Spencer, the retail shop, they use a lot of hangers on their dresses in the shops, and they just throw these hangers away. And it's really low quality plastic. And what we have done is to build a circularity story around it, is to collect those hangers, bring it to low income areas where women, some of them are sex workers, some of them are really from poor families, who repurpose these hangers, basically clean, sort, quality assure, and send it back into the supply system. We thought we should be able to retrieve 20-30%. Today we are retrieving 70%. So what we are finding is that we are able to save plastic, up to 300 tons of plastic we saved last year for Marks and Spencer. That's a huge sum of money as well as this thing. We generated jobs, 2.5 million Indian rupees in terms of wages paid. And in addition, the surpluses which were generated went to primary healthcare, what Sharia was referring to, the I4B program. So I think, Pradeep, I think in today's world, we can't look at one or two impacts. I think we do need to be creative in creating multiple impacts. And secondly, we shouldn't underestimate existing innovations and their application. Over to you, Pradeep.
Thank you. Thanks, Shiv. The reason why I also wanted to pass the question on vulnerable groups is because one of the most innovative approaches that I've seen when it comes to addressing testing uh, for particularly for men having sex with men in China is what Joe has helped create, which is the Pay It Forward. I know you're not going to speak to that, but I would love to hear from you, Joe. You've worked on, you said you're a social innovator par excellence. You represent the CHI, the Social Innovations for Health Initiative, which sits at TDR WHO. What I really tend to see is that one, innovations often have not really been measured. The impact of it often gets left out. We don't really measure the entire process and value addition. And the traditional models of evaluation doesn't really give you the kind of insights that you need to get additional resources and to report back on impact. What I would love to hear from you is how do we really rethink the metrics when we are thinking about measuring innovation? What's been your experience, and where do you see the new ways of evaluating playing into strengthening systems for the future?
Thanks, Pradeep. It's a great question, and really delighted to be with you today and the rest of the panelists. Measurement is essential to social innovation, and I think what we're seeing is a real democratization of metrics. And it used to be that the sort of researcher in the high-income country had all these tools, and they would go and measure impact. But I think it's really a very different process now. And as part of the Social Innovation in Health initiative, we created a measurement and evaluation framework and a research checklist. And so this is focused on social innovation and sort of how do we measure it? What are open access tools that we can use to better understand impacts? And M&E is really fundamental to the whole process. Measurement and metrics can help us to iteratively improve and find weaknesses. It can help us to show what the value added is and to demonstrate to funders and supporters that this is a really important issue. And it can help us to sort of build momentum. So M&E and sort of measurement and metrics are a key component. And I think we're increasingly seeing that measurement is not just about health outcomes, but as Shariha mentioned before, non-health outcomes, social, environmental, thinking about the broader social determinants of health. Many of these things can be measured and should be. And I think that's a really exciting area to think about some of these non-health benefits of social innovations, this community engagement, this sort of different relationship that we're seeing between the beneficiaries of a project and those who created it. And I also think I really liked what Mark said about the Global South and these sort of partnerships, because ultimately having a really strong relationship between the different partners can help to create a more comprehensive plan for measurement. So to really get underneath the hood of the innovation and sort of think about how it ticks to show the value that it's creating. So I'm also very much an optimist in spite of all of the COVID setbacks. I think there's a lot of different ways that we can use to measure social innovation. And for those who are interested, our CHI group has online, if you just Google social innovation in health and monitoring and evaluation, it'll be the first thing that pops up. But that link, there's an interactive website, there's a research checklist, and this is very much pegged towards social innovators in low and middle income countries. So our steering committee was focused on that end user population, and I think it's really a key process or a key part of innovation to build in really strong measurement and metrics. So thanks again, Pradeep.
Thank you. Thanks very much, Joe. I think maybe one of the things which would be really interesting is, I don't know if it is possible, I'm going to ask if Olivia can share the link in the chat box to the C website and the evaluation tools that have been created. I think that would be very, very helpful. It's a fantastic tool. I think also your slide deck, if that's available, that would be something which would be good to share if that's shareable. But maybe let's just, I've been receiving, I mean, if you have seen me sometimes going up and down like that, it's not just the Indian nod, which I'm sure all of you are familiar with, but I'm also trying to follow the chat which is coming in, the questions that are coming in from the people listening. Let me start with the easy one. Shariha, you do a lot of mentoring and support to innovators who are looking for funding and who are looking to grow. Now, if here's a innovator who has a healthcare project and is looking for funding, and they have to go to someone who is hard-nosed, looking at financials. I know, James, I'm not putting you in that position, but someone, let's say James is going to be a tough cookie to crack. You're going there. What should an innovator look for? What is it that you would advise this wonderful friend of ours who is asking this question?
Can you hear me?
Yes.
Great. Well, it's it's a very good question. It all really depends on. Well, I always think when someone comes up with a new solution to a problem, which may not be new or at all, it may be an old problem. There is always an intention behind that, right? And I think what's important when you are an innovator is to be able to somehow bring together that intention into the story of what it is that you're trying to do. I think that's the most important thing, because investors, financiers even, ultimately, they're interested in the person behind that innovation, not just about the innovation or the business model of it. You know, innovations and businesses can fail quite easily, and those of you who run businesses or who finance them would know, right, that, you know, ultimately when you look at the global pool of innovations and businesses in the startup phase, most of them fail. But that entrepreneur, that innovator, if he or she is able to really learn from that experience and to continue building on the narrative of what it is that he or she is trying to do, I think that is actually stronger than just saying, oh, I need X amount of money and this is my innovation, right? Ultimately, all these institutions are made up of people who are managing someone else's money to invest in you or finance you. They want to learn about you, and they want to be able to have the confidence that you are the person who can actually solve this problem and make it sustainable and scale. I hope that was helpful.
No, thank you very much. I'm going to flip that to James. James, if somebody is coming to you for funding, what do you look for?
Yeah, so I have this incredibly fresh example. I was on a call yesterday with an entrepreneur who I've known now for several months, maybe 6 months, in Kampala, Uganda. The more I see from his work, the more I admire what he's doing. So he started out with a point of care malaria diagnostic tool and ended up doing more disease surveillance. And then after 2-3 years of doing this with his small team, realizes that he's got aggregate health data information that the Ministry of Health and the pharmaceutical companies and that other clients will be interested in. And he begins to evolve his business model. And this guy is academically rooted. So he keeps on putting out progress reports that are impressive, really, really beautifully done. And yet I'm still not seeing a strategy. What is the strategy now? Where do you want to go next? Which relationships do you need to build? How are you going to take this larger? So he gives me a strategy document, and it's well written, and it articulates what he thinks needs to happen, but it still falls short of a business plan. And I know I'm not going to be able to generate investor interest if we can't make this a more tangible set of steps that he can quickly articulate. The second thing I know is, to Sharita's point, the guy has a delivery style that is just about as dry and academic as you can get. So while I believe in him, I'm looking for the enthusiasm. I need to see the man. So I asked him, so at the end of this meeting yesterday, I said, we need to begin to move all these great ideas into something concise and compelling that will speak quickly to an investor's commercial senses, in addition to their understanding of your focus on social impact. And we need to see the enthusiasm. He laughed at himself and recognized that I think he's gotten this feedback in the world that he comes off very dry. And so, he'll retool, because I think Sharita's point is completely right. It is about the person, it is about the story, but it's also about the business case. So I think again and again, what we encounter are entrepreneurs with amazing ideas. They understand their own ecosystem. To Mark's point, they understand the importance of interconnectedness with existing networks. They know how to tap into those networks, and they've got ideas on how to accelerate. But framing those ideas in ways that will be internationally and socioeconomically digestible, with concise stories is really, in fact, I would say it's a big challenge. It's also one of the most exciting and fun things that I get to involve myself in right now, myself and my team, because there are great stories to be told. They need to be framed in order to be translatable. I don't know if that gets to it. And I just really briefly on your point, Pradeep, about risk perception. So it's a huge issue, and I think there is absolutely a case to be made that the risk perception is much higher than is warranted in a majority of developing markets, certainly sub-Saharan Africa. There are data points, including the projected rise in health spending, including aggregate GDP for these regions, that are very compelling numbers, backed by very compelling facts. And those need to continue to be brought forward to demonstrate why the opportunity is there and the risk perceptions are too high. And that's a topic we could have an entire panel about, but I'll leave it at that for now.
No, thank you very much. I think that's really an area which we are struggling with, because we have been working now with parts of African Union to look at local production. And the challenge that comes up always is of course, there's always currency risks and all kinds of risks, but the way it is perceived is overblown. And a lot of it is, again, it goes back to communication and trying to make sure that we are able to present a case that demonstrates at least some risk mitigation and also the larger political ownership. But yeah, I won't go down that road. But one other question that has come up is really around the whole issue of there are so many successful, and it relates to Mark what you said about that kind of collaboration, the network effect, and connecting the ecosystems and not having to reinvent the wheel all the time. I think the challenge that we see is that there are so many divides, right? I mean, we have the north-south divide. Now we have uh, divides about private is all evil, there is public, and there are so many things which come in the way. But if we really want to build resilient systems for health and prepare for whatever is coming into the future, we need to start connecting the dots and building those collaborations across ecosystems. Um, Certainly across countries, within countries, across sectors. What are the lessons that we have in terms of what are the things that we can do better to build those collaborations? And I want to throw this to you and to Shiv. But Mark, I would love to hear your views and also Shiv from your perspective on the COVID collab.
I think that, as pointed by several participants, I think that we really have to think, where is innovation? We have to think beyond the innovative solution itself. And I, I think that this should encompass also innovative ways to evaluate solutions, even old ones, assess their impact, as previously discussed, in the relevant target population, or the way we can also make these solutions sustainable or accessible to the most vulnerable group. So I think that many failures have been linked actually to an insufficient knowledge of the ecosystem, to a lack of discussion, for instance, with relevant local stakeholders to understand how, for instance, a given solution, in particular in the diagnostic field, could be reimbursed, how we can create actually a kind of virtuous system that would allow actually even financial sustainability of a given solution. So I think that the earlier you think about all these aspects, the higher the chance of success. So, and I think that you do not necessarily need to really innovate. You have to really think about innovative way to assess any solutions. When you consider, for instance, even a classical extraction of massive epidemiological data, I think that if you consider, for instance, in the diagnostic field, I think that we always go back actually to the problem of financial sustainability of diagnostics in LMICs. But if you consider that, for instance, there might be solutions that can create massive amount of epidemiological data that would allow to set, for instance, probabilistic diagnostics that would not require actually on-site evaluation or on-site diagnostic evaluation, but would rely actually on massive data sets. Then in this case, you could think in a completely different way of a new business model that could really rely on technologies that are handled by many low-income countries and that could rely typically on a cell phone or whatsoever. But I think that it's not necessary. You do not have to think to a really brand new approach. You really have to think and clearly understanding the ecosystem that might be very, very different from one country to another, and taking into account all these aspects before proposing a solution and possibly a business model. And so I think that this is the only lessons that can be learned actually from all these field studies. I think that we don't know exactly where is innovation, but sometimes innovation is not in the solution itself.
That's a very, very important point. Shiv, from your experience of bringing the public and private and communities together to work together, what have you learned? What are your lessons from there? And what does it mean in terms of the future of systems for health? Because let me paraphrase that a little bit. Coming from the AIDS movement, we've always said that health has been very biomedical and there's been very little collaboration. But I know that some of the work that you have done has breaking some of those barriers?
Yeah, Pradeep, I can probably answer your question by sharing with you the current challenge in India of vaccinating 1 billion people. And that's not going to be done just by the public sector or by the private sector. And it can't be done by just supplying more and more vaccines, although even that we've got it wrong. But even if we were to get it right in the next couple of months, I think it's such a massive public health challenge to get 1 billion people vaccinated. And that is where a lot of us are doing surveys to understand what is the level of hesitancy, and the hesitancy changes by the day. And this is not an ordinary vaccine. It's going to keep away a condition, right? You may still get COVID. What we have been doing is really bringing religious leaders, community leaders, those who have taken vaccine, those who will have said never will we take vaccine, nurses, doctors together. And we've been trying to frame the issue itself. And I want to go back to James' point. He was talking about a pitch and how do you frame. I think sometimes we frame vaccination simply as a jab, right? But vaccination as a lifesaver, vaccination as something which will protect you to do your job tomorrow and earn your living. There are many, many framings which happen if you bring people together. And therefore, rather than just put it into two boxes, somebody is vaccine hesitant or confident, you actually have multiple boxes and solutions coming out of that. And that goes back to how do you frame the issue and from whose point of view are you framing that issue? And that's why working with street vendors, sex workers, transgender community, we are finding that their framing of vaccine uh, is actually the solution, not necessarily, giving the jab. So this may sound esoteric because this has really, really helped us to very, very rapidly scale up a number of delivery of vaccine in the couple of weeks. We did 100, then we did 1,000, and our pace at which we are doing now is exponential because it's people who have framed it in a way that they will take the vaccines.
Thanks very much. I'm going to have to go back to some of the questions which has come through the chat. I'm not sure who this is addressed to, but I think it's reflecting on what Mark, you said about use of data. But there are two questions which I'm going to bundle together. One is that there is use of data is extremely restricted, and we need to enable better use of data while protecting personal information. And then the other question, which is slightly related but maybe different, is how can health systems in developing economies digitally transform their supply chain models to be more resilient and responsive to changing priorities? I don't know who wants to take that, but it's a fascinating question. Over to you, panel. Joe.
I could take the first part. I think in terms of data access, and this is where a lot of our sort of conventional approaches to publishing can be stifling, and we need to have more open access defaults, and I think this is a great illustration where COVID has sort of helped us peer into the future with all COVID research being open access. And like, look at the speed of collaboration, look at the things that have been accelerated because there are no paywalls. And I hear this all the time from colleagues at institutions that don't have subscriptions to papers, and it's sort of this chorus of it's amazing how it's the public that contribute to these studies as taxpayers, it's the public who are patients in these studies, and then the end results and the actual data sets end up being behind paywalls. And we're starting to kind of see how open access has tremendous value, and funders are getting behind this with Plan S. I think we're increasingly seeing that open science it creates all sorts of opportunities that we didn't realize were so important. So I think there's a bright future for open science methods and more data sharing. The point about confidentiality and privacy is a really good one. We don't want to put data into the public realm that's going to jeopardize people or compromise safety. But I think there are definitely ways of de-identifying data sets and sort of standard safeguards that IRBs would be happy with. So I see this sort of data availability and open access. I think it's a key point moving forward. And I don't, the second part of the question on supply chain, I would punt. I mean, I think it's a great question, but I don't know. I don't have a good answer there.
No, thank you very much. I think maybe I'll just very quickly touch on that and I'll move on to the next question. We've been doing some work on basically how do you build a digital spine? And I'll take the example of a particular country. I won't name the country. They procure drugs and commodities worth 1.2 billion annually. They lose about 20 to 30% of that in purely because of overstocking and expiry of drugs in some places, where there are other places where they don't have access to drugs, because you might have an outbreak in one province which doesn't have enough supply, whereas another province is sitting with excess supply with no mechanism for them to talk to each other. And same thing happens with the supply chain, loss of commodities in the supply chain. And we are looking at the possibility of digitizing the entire supply chain. And even if you're able to save from the 200 plus million, which is lost every year, even if you're looking at half of that being saved, that is a sizable chunk of money. And especially these are low-income countries. So there is an investment case there. I'm sure James will come to you at some point to look at leveraging investments, but there are also a number of DFIs who are interested in that space, so we're working on that. I think there is an opportunity for us to look at both a digital infrastructure for health, as well as building the digitizing supply chain and monitoring and looking at AI as an overlay on that. But if you want to hear a little bit more about that, there's a session at 5 o'clock where I'm sure Christoph will touch about the potential of digital health and digitizing healthcare. I have a question. Yeah.
No, I was just wondering, Pradeep, whether this supply chain issue is merely technical or organizational, or whether it deals also with the local organization or disorganization of the country, and sometimes some, I would say, corruption issues. And typically, I think that then this is not an easy problem to solve.
I'm glad you raised it. I was trying to, because fundamentally, if you look at innovation and technology, the challenge is not the technology part, it's the culture within which we all operate. But the good news on this one is that the challenge and the loss is not unique to the developing countries. It's also in the, it's across, and it comes back to all the issues that you raised. And there's only so much you can digitize human nature, I guess, and find solutions around. But absolutely, point very well taken. And that's, again, I think maybe just speaking to the other issue, we all look at all these shiny objects and solutions as the way forward. But fundamentally, I think you've raised a very, very key point. I learned it the hard way from the person who is responsible for innovation in Israel in the parliament. I remember him saying something which completely struck me, which was that his focus, because I was trying to ask him, okay, what's your focus as the person who is responsible for promoting innovation within Israel? And Israel is the innovation capital of the world in some ways. And his answer was very interesting. He said, look, I don't look at any technology. Technology can be bought. innovations can be bought, but the mindset of innovation, the ability to embrace innovation, that culture is what I'm trying to build, which I think is probably something which we all would benefit from. I know that Jean-Francois has a young person with him, and he has promised a few questions. And Jean-Francois, you have some questions, so you have the floor, sir.
Thank you, Pradeep. Ezekiel, you want to add one question on your side from?
Yes, maybe I could just quickly go first. Thank you all again for this very amazing panel so far. So many great insights and nuggets so far. I think my question is actually related to one of the questions that I can see here in the Q&A chat box on inclusivity. So I guess my question is, we're talking about creating or leveraging innovative solutions that can build resilient health systems. So my question is, how can we ensure that inclusivity is very embedded in how these solutions are built or implemented, especially in low resource settings, in communities that sometimes lack privilege or power, or a firm say in how these solutions or innovations will affect their lives. So I'm throwing this question to all of the panelists. So maybe each of you could chime in a little bit on this. Thank you.
Thank you. And Jean-Francois, maybe you want to also ask your question, and then we can take it together.
Yeah, Pradeep, it's more a bit provocative question, if I may. I am really fascinated since yesterday and listening all of you coming and bringing some solutions or a part of the global solutions. And I would like to ask to the panel, what is missing today to all of you? We speak a lot about sharing. Yesterday we spoke a lot about sharing. What is missing to you on your day-to-day activity in order to have more efficient results with the will to have such a global partnership or such a way to share? What is lacking to you today in order to be more efficient?
Thank you, Jean-Francois. And maybe I'll just take a second to introduce Ezekiel, who asked the first question. Ezekiel is a medical doctor. He's been an innovator, and he's also helped with a lot of the design of this session. So Ezekiel, thank you for doing that, and great question. I'm going to be inclusive and include all the panelists for you to respond to the two questions. Let's start with Joe, and then we can work our way back, and brief response to either or both the questions.
Good to see you, Ezekiel, and thanks for that fantastic question. I think this is really fundamental. So like inclusive organization, how do you think about equity from the very beginning? How do you co-create? And really, I see this as who's there at the very start of your journey? Like, does the journey start with the like two white men in their high-income country, or does the journey start in Kampala, like your mother's died of malaria, you've gone abroad for your PhD? Like, I just think the kind of story and the process and that beginning, the very genesis of the idea, it's, if you have the right partners there from the beginning, then it becomes an inclusive process throughout. And so I think that genesis story is really a key part of inclusivity and sort of designing from equity. And then in terms of Jean-Francois' question about what are the pain points, what is really slowing down innovation and sort of this kind of work that we're talking about today, I think, at least personally, I would say during COVID, so much of what we do is it involves touch and feeling and interpersonal relationships, and it's really hard to replace that with Zoom calls, and you know, it's amazing how in many ways we can expand our reach, but then we also see the limitations of video conferences and just sort of our COVID reality. So I think it's also an opportunity to innovate in terms of methods and to think about how can we retain the sort of touch and feel and trust building that's important for communication in these COVID times. But just my thoughts. Over.
Thanks, Joe. I'm good. Yes, James.
I just want to build on what Joe said. I think it's all about intention. And while Pradeep on this panel, you know, you asked me to speak really to the motivators and the of capital investors, and I've been trying to speak to that. But what we see on the innovator side is a consistently high record of good intention and an intention of inclusivity. These innovators have not even initiated these models without thinking about how they can be scaled and be inclusive. And we spend a lot of time thinking about that impact measurement and the monitoring and evaluation, to Joe's points, that need to be implemented to warrant that inclusivity. And this doesn't mean it's a done deal and that every entrepreneur or commercial idea out there has sufficiently considered how an innovation can be inclusive, but there is a lot of goodwill. And a lot of it is coming also from what Joe mentioned, these individuals who have sought higher education, their MDs, their PhDs, et cetera, from different global destinations, and are returning home with that knowledge base in order to implement for the betterment of their communities. And that's a common theme. Again, glass half full here. That's common. We are seeing a lot of entrepreneurs with that perspective right now. Yeah, I'll leave it at that.
Thank you. Anyone else? Otherwise, I'm going to try and close because we are coming to nearly the last 6 minutes of the session.
If I may, I'd like to add something about the question on inclusivity. It's absolutely a very important point to build into our work here, right? But ultimately, we've also got to recognize that sometimes the exclusivity might be unintentional too, if you know what I mean. For example, in the context of the health workforce, there's a lot of work that has recognized the need for there to be more equality in terms of pay and support services for the health workforce, which are majority women. 70%, over 70% are women. But when it comes to decision making, they are not the ones making decisions because they hold less than 25% of leadership positions. But ultimately, the health systems really depend on them. So how can we think about the inclusivity agenda at many different levels, not just what James and Joe raised about the level of the patient, which, by the way, I think one of the big things to try and answer Jean-Francois's question, what is missing to have more efficient results is recognition of those who have the lived experience, those who are excluded. They actually have the deepest knowledge about the situation on the ground and about the conditions of living with that illness or challenge that they're facing in terms of access, and that they are assets, they are resource. And how can we shift the narrative from them being seen as recipients, beneficiaries, to active participants, contributors of knowledge, assets, resources that we must seek not to just include, but without whom we cannot progress what we're trying to achieve, right? So I hope I'm sort of addressing those two. It's also really nice to be like the only woman on the panel, because that's
Good point.
that's I think something that I'm sorry, I need to kind of call that out a little bit, but we need to include more voices of women innovators, women leaders, women investors as part of these conversations we're having. Thank you.
Sherry, a great point, absolutely. And that's something which was raised also by someone when it was posted on the LinkedIn and said that it's a manel. But anyway, I don't think that's defensible. And that's something which I know Jean-Francois is very, very committed to having a balanced. But the good news, we have 179 people online listening, and it's got a 50, a little bit more than 50 percent women, but we need to bring them in. And I'm sure I've asked a few questions that were sent in by some of them, but no excuses. But maybe one last sentence for each panelist. If you had a ask or if you had a message on building resilient health systems, and the audiences, whoever can make a difference that you think can make a difference, what is that one ask or message that you have? Shiva, I'm going to put you on the spot, start with you, and then go along the screen.
Just in line with what has just been said, I would say that women will make the difference, particularly in LMICs. I think that the relevant target, particularly in community, are mothers. They are those who are able actually to probably address the uptake issues, probably advocate for a given solution, be it therapeutic, diagnostic, and so on, that can be educated and who are the strong willing to be educated. So I think that women will be the issue.
Okay, move over, man. Women, come on. And I think I love your one sentence because you didn't pause anywhere for a comma or a full stop, but that was a good long sentence. But sentence from you, Shiv.
I would say collaborate. This is a time where borders have melted between sectors, between kinds of organizations, and between what we classically call as public and private and civil society. I think collaboration is the only way that health systems can be built. Poor communities are not going to look at your public, your private. They want the service.
James.
Well, you guys have made it easy. I couldn't agree more about the centrality of women in the kind of changes that need to happen. It's absolutely right. The minds, the hearts, the sensibilities have to be central to the solutions. Collaboration, absolutely. The only thing I might add to all of this is thinking generationally. We have a different set of attitudes that have emerged from the millennials on down in terms of their digital native kind of approaches, as well as their sense of urgency. And this is gonna drive change. And those of us who are not part of that generation need to keep on tapping into what those perspectives are that are emerging and that can really accelerate the change that needs to happen.
Thank you. Joe?
I would say to jump in that there is a huge urgency to doing this work, and many times we hesitate because of distance or barriers or all sorts of things. But doing social innovation is an iterative process, and you've got to start the journey and jump in and work out these thorny issues. So it's really a delight to be with all of you today, and I completely agree with the other panelists, and really fun to be here and chat with you all. Over. Back to you, Pradeep.
Thank you very much. Before I give the last word to the woman on the panel, I have a task for each one of us, because all of us believe that it's women, and Mark, completely agree with you. I think it's women who are going to make that difference, women who are going to move that. And I would say and you know that I have a woman leader who's absolutely brilliant, Bini Banyema, who is at the forefront of COVID vaccine access. And at one point of time, we had a very interesting conversation saying that the challenge we have with the distribution of vaccine, COVID vaccine today, is that it's the male leaders, men leaders who are fighting with each other, showing like they're the big boys. We were trying to pull together a panel of women leaders and saying, because the country I come from, it's the women who distribute the food in the house so that you know how much to give to the child, how much to give to the man, how much to give to the adolescent, the teenager. I think there's something that we missed in the whole COVID vaccine distribution. It's a big mess, but that's a different story. But also the task that I have for all of us who are on this panel, but also all the men who are listening, who believe that women's leadership matter, join on Friday at the Ahimsa Forum. Saba is going to be leading a session on women's leadership. Saba is an amazing woman leader herself, comes from a lot of work in the humanitarian sector, but has a fantastic story to tell about her lived experience and bring about change in the Middle East. And you'll really see what women leadership means. And she's going to have a fantastic panel around that. You'll find the details on the website. But Sharika, you have the last word.
Thank you, Pradeep. Well, thank you to all my panelists for recognizing the importance of women, but also, those of binary genders in this discussion. I think I will leave perhaps with a reminder that ultimately, what's most important is that, as Anthropocenes, we are all humans, referring to the poem that was shared by Sudeep, the Indian poet, before. And we mustn't forget the importance of the human connection. Even in the context of the supply chain question, ultimately, who goes to that last mile? It's the human being, right? Mm-hmm. And maybe another point to add with this kind of new normal we live in, if I may cheat a bit, Pradeep, and share 2 sentences, is that, one amazing thing that has happened, there's been a lot of sorrow and all that, but one amazing thing that has happened from this new normal is that it has normalized new. There's a bigger openness to doing things in new ways, having new partnerships and trying new things. Let's work with that. Let's build on that. And if we can make that connect with the human piece, I'm sure we can all do magic together. Thank you.
Thank you very much. It's been a fascinating panel. I really want to thank each one of you, Mark, James, Joe, Shiv, and Shariha. It's a conversation that needs to continue. And I know at the beginning, I was wondering whether we should go into the different innovations that are exciting and what does the bigger digital innovation piece look like and where the opportunities are. But we do have a session starting in less than 30 minutes, which is going to focus on innovations. And Mark, James, you use the data from the FT Lancet Commission. So Christoph Ben is going to be joining us and presenting both some of the early thinking from that, as well as the digital collaboration initiative. So please do feel free to join in 5 minutes. But on this particular session, I just want to say we have an opportunity to define what that post-COVID looks like. And if we are all living in a time when 1 out of 2 people don't have access to basic healthcare, then there's something wrong with the world. And that cannot continue, COVID or no COVID. We can make that difference. I think there was a lot of optimism. There was this glass half full story. But I'm really a believer that that glass doesn't have to be half full. It can be really full. It's just a matter of how we come together, collaborate to make that a reality. Thank you so very much for your commitment. Jean-Francois, thank you so much for this session and for being there. Look forward to seeing you soon. Thank you. Have a wonderful day, evening, morning. Bye.
Spreading so fast, healing and sweeping. jamani